What's up? It's Laura Huckman, the medical matchmaker here. Today we're going to talk a little bit about some interview questions that you are going to ask your employer. Now, I could talk about this topic probably for days on end without stopping, but we're going to focus on three things today. We're going to focus on support staff, having a voice in your practice, and what to ask when you're interviewing for a practice that's more of a eat to kill model. And I'll tell you what that is. So, in every practice, you definitely want, when you're interviewing for a position, you really want to make sure you get your questions asked. Every now and then I'll speak with physicians who've really been burned as far as, either having absolutely no support staff or, not having a voice. And not having a voice is probably one of the most common things I see, most commonly with the big systems, but in every setting really. And then, what to do when the practice is smaller and works on the eat to kill model. So if you're coming from a practice, perhaps there are no medical assistants, no nurses, no phlebotomists. You do it all. Like you take the blood, you take the swabs, you put the swabs in the tubes, you label them, you send them off to the lab, whatever it is. You really need to have a far lower patient amount of patients that you're seeing to be able to do all of those things. If you're in a practice that doesn't have the support, then you really need to be seeing less patients. And if you're not seeing less patients, well, that's when I get the phone call to find a new practice. So if you're a practice owner watching this, that's what people are calling me about. One of many things. So to figure out when you're interviewing for a new position, what kind of support staff you have, you really want to dig into, tell me about your medical assistants. What do they do? What is their training? Do you have certified medical assistants or do you train them yourself? And if you train them yourself, what is it that they're trained to be able to do? One of the practices that I'm working with right now, this is one of the kindest physicians I've ever met, and she runs a pediatrics practice in New Jersey. She has in her practice medical assistants that are physicians in other countries that couldn't get certified in the US. So when one of her physicians walks into the patient room, they're pretty set. I mean, these medical assistants can preempt everything you'll need. They'll have already done it. Of course, they communicate with you in a way that works for you. So if you don't want them to take a swab before they see you, they don't. But this is kind of the extremely good side of support staff where, she has the medical assistants do a lot, and they're happy doing that too because they get to use their skills and be a really important part of the team. She also has scribes. So another thing you really want to ask about is scribes. So are you going to spend all of your time in the evening charting, or when you leave at the end of the day, is your charting done? There's another practice I'm working with in New York State where they don't have scribes, but they have such a robust template system that same thing, you finish your notes pretty much between patients because your templates are so good that when you leave at the end of the day, you're done. So what kinds of systems are in place to support you to be able to practice medicine without all the distractions of all the other things that you really don't need to be doing? Or if you're doing them, what is your patient volume to support that? You also want to be asking about how much time in the evenings they spend charting or they spend getting back to their patient messages or lab results or all of that. You can ask, what is the process for getting back to patients with lab results or questions, after hours and during hours? So in some practices, the patients know not to call the after hours line unless it's a true emergency. And in some practices, they call for every little thing. So it all depends on what your patients are used to and what you've kind of allowed them to do. So those are some really important questions. As far as figuring out if you'll have a voice in the practice, so here you're going to want to ask about specific examples. So if you're interviewing with a physician in the practice, or if you're not interviewing with them but you're speaking with a physician in the practice, you want to ask them, what are some changes that have been made recently because it was something that you brought up? Or what's the process for making a change if some sort of change is needed? And you can give examples of, a change that you would have liked to see in your practice. So you can say, for example, I was working in a practice where we had one ancillary office staff who, wasn't stocking the shelves ever, and we never had our equipment that we needed to do our job, and we couldn't get rid of them no matter what we did. We couldn't get them trained, we couldn't get rid of them. How would that go in your practice? Or can you give me a specific example of a change that needed to be made, and then what happened because of, someone said something? So this one is very important to ask specific questions. What has been done in the past? Or you can ask physicians, do you feel like if a change is needed, that change happens? Do you feel like there's transparency in what you're being asked to do or anything like that? And the other one, which is the eat what you kill model. So what I mean by eat what you kill is when you see a patient, you get paid. When you don't see a patient, you don't get paid. Usually this works in a percentage. So the practice will take, just say you make $100 on this patient, then they'll take out the overhead in a small percentage, and usually you'll end up getting roughly 30%, maybe 40%. It varies by practice and how much overhead they have. But so as far as eat what you kill, if you want to make sure that you're going to get a good salary, so a lot of the physicians that I speak to, salary is their number one most important driving factor for how they pick a job. So in the eat what you kill model, that tends to scare some people away. But if you're really interested in the position and you're willing to look into if it's worth the risk, which it often is, you want to figure out, is it something that's sustainable? Is it something that will make me a salary? Is it something that I can feed my kids and pay off my student loans with? So here again, you want to ask for specific examples. So the one thing you want to ask for is, what is your plan to grow the practice? So how do you plan to market me as a physician in the community? And you want to hear a good plan. So that will be things like, we have a good referral network and we're going to have you go around to the different practices and introduce yourself. It can be things like, we have a very good social media presence, and so we're going to have you come on our social media. We speak in public frequently, and we will give you talks to do in public. We'll support you with that. So there's a lot of different things that practices can do to support you and to support your practice growing. So that's the one important question. Another is to know how people have grown in the past. So you want to ask the physician, when you joined the practice, how long did it take you to reach these milestones? And, what are your numbers? How much, how many patients do you have? All those things. So you want to ask very specific questions so that you can really understand what it means when they say you're going to take a percentage of profits. Because if that's, if you're going in and you don't really know what your salary is going to be, that's okay. You just want to make sure that the practice is run well and that they have a plan for growing you as a physician. So I really hope this was helpful. I'm always happy to, help anyone come up with questions, but these are some things that I think are super important around support staff, having a voice in your practice, and how it'll work if you're working on a profit sharing or revenue share only. And it's not necessarily a bad thing at all. Remember, small private practices are small private practices. They're not large systems. So I hope this was helpful. If you have any questions or comments, please leave them below. And of course, if you're looking for a position, I have practices all over, or if you are just wondering if the grass is greener, please do reach out. My website is www.happydayhealth.co, and I am always happy to chat. All right, nice to see you. Bye.